So yeah, mine is going to be a little different from what you've heard. There no models here. It will be a very NGO presentation. So Swasti is a health resource center. We are based in Bangalore. We were established in 2002 by a team of passionate individuals working in the area of public health. So basically, we look into the problems plaguing the public health, and we find out solutions. We build models to solve those problems, and we either pilot those models ourselves. We look for grants. Or we work with already partners working on the ground, and we provide technical support to them. Some of the areas that we've worked in the last 12-15 years is sexual and reproductive health and rights. So HIV was one of the earliest programs that we started, and we continue to work in HIV. We support the national government in the HIV programs. We work in the life skills for all. We work with the factory workers in government factories, the women working in factories. Water, sanitation, hygiene is a big area for us. Then technology public health is something that has been cross-cutting for all the themes. We ensure that we bring in technology in all the work that we do. Safety, security, justice is an important work for us. We look at sexual harassment, how do we prevent harassment in workplaces, and social protection. How do we help the communities get access to the thousands of schemes that government has, and how do the communities benefit from that? So it's been cut from here, but we've reached about 400,000 the poor and marginalized communities in the last 15 years. And for us, I think for us the vision is a world of healthy people, and how do we do it is we ensure that the communities get access to the most number of options, not limited by choices. So what we've realized over the last working 15 years is we have heard a lot of partners, people working on the ground, that they're working in particular areas. There's someone solving the problem of diabetes, there's someone solving the problem of HIV. But then I think the team was frustrated by by areas where not everything is getting solved. So if you solve one problem, there's another problem creeps up. So how do we bring all of this together? So last 1 year, we're working on a model called Invest for Wellness, where what we've realized is to solve the problem of what we require is someone who works dedicatedly in not just one particular area, but works with the family in all other areas. What we require instead is we need to bring in financing, medical science, behavioral science, social science, and technology together to solve the problems of public health. And how do we do that? So we have a local community health facilitator working with the families who's responsible for providing 24/7, 65 days a year, responsive, friendly, trusted, quality, and affordable and accessible care to the members. And so, we have data from the geographies that we've worked, and we have prioritized some 10 conditions that we'll work in, and we'll bring in technology, we'll bring in partners, we'll bring in products together, and we solve the key problems of sanitation, air, water, and food. So I just touched on what we have done in technology in the last couple of years. We've used technology for data collection. We've moved from paper-based to app-based data collection management. We have developed tools for engaging with the community members. We have developed monitoring and evaluation tools for all the programs that we have done. We have developed milestone tracking platforms for governments, for founders, and for foundations. We've developed tools for doing community feedback mechanisms from communities. And some of the recent examples that I just want to share with you are work in TARUS. So TARUS is a Bill and Melinda Gates Foundation funded program for sex workers. And that program has been running for the last 15 years in India, and we've developed a platform for not just data collection, but engaging the communities. So I think what Shriman mentioned in the beginning, how do we use community members not as someone who provide data, but we interact with them and get data from them, and not just not just form-based mechanism. So we've developed a mechanism where the health workers goes out to the community members. They talk to them. It's not just asking what's your name, what's your age, but you help them solve their problems. And in that process, we collect data on an app that we've developed. So that app currently is being used by about 500 users in 48 districts in 5 states of southern India. And it has live data of about 1 lakh participants community members. And we have dashboards at right from the community level, to the district level, to state level, and at national level. So some of the features of this app are there's one-to-one engagement with community members, and so these are sex workers who face incidents from the society they work in. Then this app will help them. The app has a database of all the SP schemes that the government has, and depending on the gender of the worker, the state, the district, the app will tell them which schemes are best for the community member. And this app will also help them apply for the schemes. It's integrated with the national portal for the government. The second one that I want to share with you is Soyojana. So this is something that we had piloted with a company called D-Tree based in Boston and Karuna Trust in Bangalore. We had developed a tool for the ANMs, auxiliary nurse midwives, using decision tree models to work in the area of maternal and neonatal care. So we had tried this in 31 with 31 ANMs and across 4 districts in Karnataka. What we learned from this is that I think the design of the app is a very crucial aspect of what we do. Some of the challenges that we've learned by working in technology is I think we need to go beyond data collection. I mean, at least in the area of work, the team is still focused on how do we move data collection from paper-based to technology. And also, I think what someone mentioned, that the field teams, the health workers they're not really tech savvy. Most of them are using smartphones for the first time, and it's really important to orient them to how do you use a smartphone? What happens if a screen goes blank? How do you charge your phones? Plus, so we are an NGO, but we work with the tech companies, and how do we, and they have teams full of coders. How do we translate what we understand in the development world? How do they understand? And marrying both the sectors is very important. We have also found that the hardware and software we've struggled a lot with, between the incongruencies. The phones should be able to support what we're developing, and if we go to ground level, there are a lot of frequent crashes. When you update an app, it has to go to all the field workers. And ensuring data quality. How do we ensure that the data quality that's collected on the field is top notch? How do you ensure that the field workers, they know what questions has to be asked? How do you ensure that there's no noise coming in the data? And some of the lessons that we've learned, yes, I mean, how do we not go from a concept of baseline and an endline? How do we build data as we interact with the community members? We build data by every step. We've also learned that designing technology from the ground base to ensure that the technology is future ready. What you've realized is what you did something 2 years back, we cannot use the same thing now. So, I mean, having a good design at the base is very important. And the community must really feel that the technology is something that is out there to help them. I mean, we have realized the community, they often feel threatened when they see a phone in front of them. So getting a good buy-in from the community is very important. And one of the most important things we have found out that the technology brings a lot of transparency. The field workers, they know that there's someone sitting in the national office monitoring them. So how do we prevent games being played by technology? So, and where do we see use of AI right now? So what we've learned is, if we want to scale up, we'll need technology, and how do we ensure that we are there where it's needed? Finding out which households and individuals are prone to be more vulnerable, and how do we bring them in the radar, and not looking at the whole cluster. Understanding behavior patterns of the users. I mean, how do we track that the users are using the app properly, and how do we send special customized notifications to them? So for us, household is a unit. We don't look at individual members. So how do we identify which households are prone to certain kind of problems, and then segmenting them and being proactive and not reactive. And understanding. So first, we are looking primary care. So understanding the synergy between diagnosis and how are we curing them. So how do we ensure that we learn from the symptoms and we become more proactive and not reactive. That's it. Thank you.